Let's now move on to our weekly regular segment where we turn to a medical expert for a more in-depth diagnosis on the current issues surrounding COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you again for joining us.
Thank you for having me.
So we're just back from a 3-day-long holiday to mark Liberation Day here in the country. And ahead of the holidays, the government announced measures to prevent the further spread of the virus. We still have to see how the situation unfolds over the next couple of days. But yesterday, the nation reported its highest Sunday tally. Authorities are mulling over whether to extend or even strengthen social distancing levels this week. So as a medical expert, how much do you think this is necessary?
I think definitely measures will need to be extended and probably strengthened as well. And the reason why is because of dwindling hospital bed capacity, especially ICU capacity. But it's not just the number of beds. It's also the number of ECMO, ECMO machines. These are basically artificial lung machines that keep patients alive who have severe COVID-19 affecting their lungs. Once we run out of ECMO machines, then unfortunately, we may have to let some people die because they can't access the machines that they need. So we absolutely need to bring the numbers down. Otherwise, we may be running into a crisis situation in terms of hospital bed availability and equipment availability.
Now, with the spread of the more transmissible Delta variant, the country is entering a new phase. Initially, the government planned on achieving herd immunity by vaccinating 70% of the nation's population. But since a latest survey shows that only 0.33% of 1,200 respondents had antibodies, authorities are considering raising its vaccination target rate. Dr. Tan, can you remind us, what is herd immunity again, and how much of the population needs to be vaccinated to achieve this?
So the concept of herd immunity is basically a threshold level of immunity within the population that prevents the rampant spread of an infectious disease. Previously, we thought 70% of the entire population being immune might have been enough, but the Delta variant has changed the calculus. Because it is so transmissible, so infectious, experts are now raising that number to 80% of the population. That's including children, adults, adolescents, everybody. 80% would need to be immune before population herd immunity is achieved.
Now, we're suffering from the Delta variant, but another strain of COVID-19 called the Lambda variant is spreading globally, with the WHO confirming the variant in 31 countries. Now, the variant first detected in Peru last year spread quickly across South American nations, causing concern due to its high fatality rate. Can you tell us more about the strain, and do you think these more powerful strains will continue to come?
So the Lambda variant is now a variant of concern. It has 2 mutations in the critical spike protein region of the virus's gene, L542Q and F490S. It may be more infective than even the Delta variant, and it may have immune escape properties. In other words, protection, immunity from prior infection or from the current vaccines may not protect as well against this variant compared to the original strain or the alpha variant strain. There's research going on, data that show that perhaps the current vaccines will be effective against the Lambda variant, but the research is ongoing and we're waiting for more data.
Now, Dr. Tan, since the world has been living with the pandemic for more than a year now, there are voices that say COVID-19 will not end, enduring like the flu. But the government seems to be opposed to this idea. What are your thoughts on this? Do you think it's possible for us to return to pre-pandemic days?
I think we will be able to return at some point to some semblance of normalcy, but it's my opinion that that COVID-19 will become an endemic disease. As you said, it's going to be like the flu, We will need booster shots on a regular basis at regular time intervals. And the reason why I say this is because we do not predict that we will achieve population herd immunity for the entire planet, which is what we need, until 2023 or perhaps even 2024. So in the immediate future, at least the next 2-3 years, this COVID-19 is not going to go away. And in the interim, we may see more virulent, more infectious variants emerge. And then basically it's 2 steps forward, 1 step back. We may be having another surge like we are experiencing with the Delta variant.
So we are experiencing this tough situation. I hope everyone could cope up with this well. Now, I'm afraid we will have to wrap up our discussion for this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Thank you so much for your wonderful insights again. We will see you again next Monday.
Thank you.